It's been more than a week since emergency room doctors at Surrey Memorial Hospital released a letter describing what they're saying is a crisis in their unit. Now City News talks to patients about their experiences in the ER.
We had to wait like 6-7 hours just to get in.
We just sit down and waiting for what? That's my question. Where are the doctor? Where are all the people? I don't understand.
We fell down in the kitchen and she waited for several hours, more than 8 hours, from 3 o'clock to midnight.
Dr. Urbane Ip, an ER doctor at Surrey Memorial, says the situation at the hospital has hit a boiling point and more beds and doctors are needed to mitigate the congestion.
Surrey has always been behind in resources. We know that because our population explodes and we always have to chase resources.
He says even after some patients are admitted and seen by an ER doctor, some are forced to wait for specialized care.
They won't be seen maybe 24 hours by a physician, maybe 48 hours, sometimes 72 hours. Now that is extremely problematic for us. The emergency physicians, when they finish their shift, they go home worried because they don't know if their patient is going to be taken care of. They are the last doctor who saw the patient. If the patient deteriorates, they blame themselves. Of course, the patient doesn't know, the family doesn't know your system. You're the last one to see. Of course, if something happened, who take the fall?
So we have objectively more people in hospital right now and more visitors to emergency room in addition to the increase in population we're seeing. So we have been putting resources in. We're going to have to do more.
BC's health minister says more family doctors will help relieve the pressure on emergency rooms. And his ministry has been recruiting doctors outside of BC.
The new family physician contract, as you know, has been unbelievably successful in attracting people back to family practice. 500 doctors who didn't practice family medicine last year are practicing under this model.
And unfortunately, after 6 years of NDP mismanagement, we're facing the crisis that we're facing right now.
Opposition leader Kevin Falcon says there's a lack of acute care beds in Surrey.
Vancouver's got 5 times more acute care beds than does Surrey, and this is the fastest growing population in the province. That's part of the issue. The other part is to make sure we've got hospitalists in the hospital to be able to take care of the patients that are coming through the busiest emergency department in Canada.
What would improve the situation here?
I feel like more doctors and just more nurses also, because we were asking for help and no one helped us.
From Turkey, if you compare, Turkey it's faster. But the difference here is better, it should be better.
Because we were told that there's only 4 doctors, and I feel like there should be more.
In Surrey, Angela Bauer, City News.